Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sidis. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. Hey, I'd like to welcome Dr. Aaron Berger from the practice I work with. He's going to talk to you about the various treatment options available for testosterone. Take it away, Aaron.
So let's move into some treatment options. So one of the first kind of treatments for at-home use was the testosterone gel. There were, several brand names when this was available as a branded medication. There was, Androgel. There's one called Axiron for a while that went under the armpit, almost like a deodorant. There was Testim, which was the little tubes for single use. So really now all of those are generic. So the most common is just the testosterone gel, which does come in, different strengths. It's typically 1% or 1.62%. We do have some patients who get the pump, which is the most common. Some insurances still use the single-use daily tubes. So typically this gets applied to the upper arm, shoulder area daily. I typically recommend, having patients do this, after they shower and are getting dressed, because you don't want to get this wet for at least 2 to 3 hours after application. There is the risk of transference. So women and children really should not be, coming in contact with testosterone gel. So for people who have children or grandchildren who are on therapy, if the patients are on therapy and they have children or grandchildren, coming by and they have short sleeve shirts on and they, the kids are jumping on them and playing with grandpa or dad. You don't want to have the kids be in contact with the testosterone gel. So they got to be cautious of that. These are generic at this point, as I mentioned. So often this is the initial therapy that we can get insurance coverage for. There is a percentage of patients, roughly about 15-20%, they just don't absorb this well. And it's unclear exactly why this is. As I tell some patients, they could take a bath in the stuff, it just doesn't work. So some patients who do 2 pumps, 3 pumps, whatever, their levels just don't budge. So it's unclear exactly why that is, but for some people, it just doesn't work. And in some patients, they do get some skin irritation. It's not real common, but it certainly can happen. Everyone, there's people have sensitive skin, so that can happen as well. There is also a testosterone patch. I think that used to be called Androderm. But that's generic as well now. So there's 2 milligram or 4 milligram patches. So you do 1 to 2 patches nightly, lasts for 24 hours. So it's between 2 to 6 milligrams is the dose you want. So you do, a combination of 1, 2, and 1, 4, or 2, 2 is really depending on dose titration. Again, these, can work pretty well, assuming patients can absorb testosterone through the skin. But again, some skin irritation can occur, and this is more common as far as skin issues with the patch than it is with the gel. Clomiphene. So clomiphene is a medication that's been around for a long time. It's classically used for infertility for women to stimulate ovulation. But since the pituitary pathways for men and women, as far as LH and FSH, are similar, it is also used to help promote the production of more LH, which then stimulates the testicles to produce testosterone. So basically, clomiphene blocks the estrogen receptor at the pituitary, and estrogen basically is acting as the off switch, in essence, for this hormonal pathway. So some testosterone does get converted to estrogen naturally. So when the pituitary sees estrogen, it basically will decrease the production of LH and FSH for men. So by blocking this with the clomiphene, it keeps the LH and FSH production going, which will then subsequently go to the testicles and increase testosterone production. So this can be taken either 25 milligrams daily or 50 milligrams every other day, which is what I typically use. And if patients do have an interest in future fertility, this is really the go-to medication, in my opinion, because it does not suppress and in fact enhances their sperm production. So they may have even better chances of more children than they do without the medication. So it kind of has a double benefit if patients are having some issues. A lot of infertility patients, when they're going through that stress of that whole process, sometimes the interest in sexual activity or the libido is decreased, and sometimes they do have a low testosterone or low normal testosterone. So this does have somewhat of a double benefit. And it is generic, so it is relatively easy to get and get covered for patients. There's also 2 other oral medications, which are actually synthetic testosterone. So these are not stimulating. Pretty much everything else we're talking about here is not stimulating natural production, but this is This is actual testosterone therapy. So Jatenzo has been out for a few years. It comes in 3 different strengths, all nice round numbers, 158, 198, and 237. So not sure exactly. I'm sure the studies just found those were the right doses, but a little confusing there. But so you can always reference your pharmacy book. But the starting dose is typically 237 milligrams twice a day. And then once you get patients started on therapy, you can either go up or down, depending on how their labs work and how they are feeling. Another newer medication came out a couple years ago called Tilando. This comes in 112.5 milligram pills. And again, starting dose here is 225 milligrams BID. So you're taking 4 pills a day. So it is a decent number of pills. Both of these, in my experience, do work well. But they do have some difficulty as far as insurance coverage. So, especially because these are oral medications, these come out of patients' pharmacy benefits, not as much as their medical benefits, which is 2 very different things. So the cost of these sometimes can be prohibitive for some patients, but if they are able to get them, they do seem to work pretty well. Testopel. So Testopel's been around for, it's probably 15, 16, 17 years at this point. So basically, this is small pellets that are about 75 milligrams each. These are implanted subcutaneously every 3 months. Typically in the buttock is the typical place that these are placed. So the starting dose is typically 6 pellets, but then you can titrate up if levels are not therapeutic and or if their symptoms are not improved. So basically, the patients come in, you prep a little area in the kind of the upper outer quadrant of their buttock. You make a small stab incision, and then there's a needle and a little trocar needle that goes in. You slide that in, and then you remove the inner part, the stylet, that has the sharp point on it, and then it's basically a hollow introducer that you slide the pellets in. It's kind of like loading a shotgun. You kind of slide the pellets in, and then you use the little pusher device to push them in. And if you're using more than 6, then you can either do 2 rows, so kind of in a V pattern. So I typically will kind of do like one go in this direction, one go in that direction, or some variation. And there's also a technique where you can stack them. So you kind of do 3 deep or 6 deeper, and then a few more closer to the surface. And then basically you just do a little steri-strip and a little tegaderm, and that's it. And they do that every 3 months. I mean, the whole procedure takes a minute or 2, and patients tolerate this pretty well. And it is kind of out of sight, out of mind. We put them in and they're good for 3 months, and they don't really have to think about it. And there's no risk of transference, since there's no way anyone can, touch under the skin in their buttocks. So that's not going to be a concern. Another option is something called Avede. So Avede is a depot or long-lasting intramuscular injection. It only comes in 1 dose, and it's done intramuscularly in the office. And patients need to be watched in the office for 30 minutes. So when they did the clinical trials, there were the emulsion liquid that this is in, has some fatty droplets. So there were a couple patients that had some shortness of breath, and they found they had these small, basically like little fat emboli that can go to the lung. No one died from this. This isn't like a pulmonary embolism where people drop dead. They just had a little shortness of breath, and then they were fine. But based on those couple situations, the FDA does have a warning that you basically have to observe these patients and document you observe them, and that they had no respiratory issues for about 30 minutes after the injection. So these days, when everyone's got their phone, they can sit there and watch Netflix or whatever. It's not that big a deal. or watch past episodes of Euronurse would be even better. Then they have something to do, so it's really not that big a deal. Most people don't really have a problem with this. The schedule with the VEED is you do an initial injection. The second injection is about 4 weeks later, and then subsequent injections are every 10 weeks. And the recommendation from the company that makes this is that you don't check their repeat labs until after that third injection. There's kind of a ramp up period to kind of get the levels to steady state. So if you check their testosterone after the first or even the second injection, you may not see that they're having the full effect. So you also want to counsel patients not to be discouraged if they don't feel fully improved until after that third injection. And then there's this generic IM injections, which people can get through specialty pharmacies, compounding pharmacies, or a lot of even just local drugstores, Walgreens, CVS, whatever, will carry testosterone. Cypionate, which is the most common form used. So this is something a lot of times patients will just be instructed to do at home. They can inject themselves in the buttock and the thigh and the hip. And this is typically done either 50 to 100 milligrams, either sub-Q or IM weekly, or some patients that don't want to do the injections as often, do 100 to 200 milligrams every other week. It's relatively inexpensive as it is generic. But since you're doing these frequent injections, the testosterone levels do tend to kind of yo-yo a little bit, or if you track their testosterone, it does have a little bit of a sawtooth kind of appearance sometimes, where they'll kind of go up and they're good for several days, and then it kind of starts coming down, especially if they're doing it every 2 weeks. But it is a relatively inexpensive option. It's pretty readily available, and a lot of patients do fine with this. And again, there's no concern for transference because it is going either under the skin or in the muscle. Along the same lines is another medication called Xiasted. So Xiasted is a weekly auto-injector. So I liken it to an EpiPen that people use for allergies. So basically it comes in 50, 75, or 100 milligram dosages, or that should say 50 milligrams, not 50 grams. That would be a little much. Patient never really sees the needle. So patients who just can't do an injection themselves because they have a needle phobia. I'm sure there's a better name for needle phobia than needle phobia, but that's a lot of patients just don't like needles, or can't inject themselves, or don't have anyone at home that can inject for them. So the nice thing with this is they never really see the needle. So they basically take the little cap off the device, they squeeze a little area of belly fat, hold it against the skin, and basically press the button. And after about 10 seconds, they hear a click, and it's there, and that's done. So this is subcutaneous weekly. Again, this is a very good option if you can get insurance to cover it. But a lot of guys really like this, that in my experience. But again, it does take a little more work as far as getting coverage. So those are the main options. I think I neglected to mention there's a nasal gel called, I think that's still around, called Natesto. I don't know. I haven't heard a lot about that recently. It was a nasal gel testosterone that gets absorbed through the nares. But I've not seen that one recently. So, but it's another option again that is for patients who fail topical gel that doesn't go through the skin.
Hey, thanks, Aaron. That was really great. Hope everybody enjoyed that. And be sure to check out our handouts, because we'll have handouts on all those medications that were mentioned. Also, be sure to join us next week for more on the UroPatient podcast. Have a great week, everyone.